Lúc bình thường thì hai mắt dường như là 10 cân. Khi làm cover test thì dưới miếng da mắt phải chảy
9 tuổi và đến khám tại phòng lé vào ngày 8 tháng 6 năm 2012 đến nay. Về bệnh sử thì người nhà phát hiện lé từ lúc 1 tuổi và thường là lé mắt trái. Khi nhìn xa lơ đễnh không tập trung thì bé mới thấy lé. Còn bình thường thì không thấy lé, thỉnh thoảng.
For us today, we're talking about anesthesia for pediatric ophthalmology surgeries. Okay. So initially, the pediatric population we divide into 3 categories. First, neonates from 1 to 28 days old, infants from 1 month to 12 months, and children from 1-year-olds to puberty. Each subset actually has its own specific physiologic and anatomic differences.
And this is what they found. After 5 weeks, after their study, each of the patients with glasses only improved 2 lines. And almost 60% have more than 2 lines. For a patient who have moderate or severe, about the same improvement. And this is also good to know, is if you have bigger anisometropia, your success is not as good.
You will see then when you're dissecting the extraocular muscle, there'll be that tough fibrous band extending from the side of the extraocular muscle. Many times you can't sweep them away with a Q-tip. You really have to incise them. Sometimes you can't sweep them away. And you usually want to make a little bit of an incision in them to free up the muscle for the surgery.
For dustier environments, the hardest lens to wear is a corneal rigid lens because dust gets underneath the lens. So you might choose a little different fitting strategy if it's available to you. Soft lenses will generally work better. There are some soft keratoconic designs that are working fairly well for mild to moderate keratoconus, so maybe we're kind of getting something like that here. The other thing that works really well for that environment or for ocular surface disease and irritation are scleral rigid lenses that I fit a lot of these on patients who are in dusty environments. The rigid scleral lenses, you fill the lens with saline, and so your eye really has a saline